Hi, this is Dr. Pata. I'm talking today about the Missouri's medical marijuana program and some of the information that patients need to guide themselves through the process of the Missouri's medical marijuana program. So the science behind medical marijuana. It's not weed anymore. It's not the drug that most people grew up with. Medical marijuana is highly sophisticated. This is about personalized medicine and the use of medical marijuana, the appropriate dosing, safety, the concentrations of different compounds, THC, CBD, and a host of other compounds, the entourage effect, terpenes, and everything else that goes along with it. Marijuana historically has been used for thousands of years. We have at least records back 12,000 years in southern and central Asia. Shamans would use this plant, and it was a necessary ingredient to achieve spiritual transcendence. They transported the seeds for this plant. They carried them around. Its aromatic buds were used for perfume, medication, intoxicants. They kept these plants active. They transported them through the foothills of the Himalayas to the rest of the world. It eventually ended up in the New World here in the United States. There's some articles published basically in Chinese pharmacopoeia around 2600 BC, documentation of its use for physical, psychological, and emotional purposes. And it was used quite commonly even in the United States until 1932, when the Uniform State Narcotic Act prohibited the use of marijuana and limited it to basically research purposes. In 1986, there were only 8 articles listed in PubMed under the topic medical marijuana. But now, in 2019, there's over 1,500 articles published. That's an 18,000% increase. So the interest from the medical side has really dramatically grown, even though people have been using medical marijuana forever. Until recently, it was illicit. It was illegal, even at the state level, everywhere. But now, more than half of the population has the ability to use medical marijuana at the state level. Over 60% of Americans polled believe that medical marijuana has a benefit. The cannabinoids, CBD, cannabidiol, and tetrahydrocannabinol, THC, are the 2 main compounds that we talk about, but there's a whole host of about 400 compounds inside medical marijuana. These agents modulate and influence the body's physiologic system through the endocannabinoid system. This affects everything from appetite to pain to inflammation, sensation, muscle control, energy balance, metabolism, sleep, reward, memory, stress. It's a whole host of things. The endocannabinoid system is probably one of the most diverse systems of receptors in the human body. Medical marijuana has been shown to benefit patients experiencing cancer, neurologic dysfunctions, psychological dysfunctions, some metabolic dysfunctions, and some pain disorders. And there's good literature for support for that. CBD and THC are currently the most studied extracts from the plant species Cannabis sativa, but they're not the only ones. There's about 400 other compounds in there. Currently cultivated Cannabis sativa has a much higher concentration of THC than even what we had 10 years ago, a ratio of 5x to 7x greater. And because of that, some individuals who now use THC or CBD or THC have an extremely dysphoric reaction. They have what would be described as an extremely bad trip. And that's because the THC concentrations are far greater than what they would expect. So I'll be talking a little bit about CBD and THC. CBD stands for cannabidiol. THC stands for delta tetrahydrocannabidiol. And THC is typically the compound that we think of that gives our altered mental status. CBD is typically the compound that has no dysphoric effect, has no hallucinogenic effect. So THC has a psychoactive component. It increases appetite. It can cause some weight gain. We know that it helps in cancer. We know that it helps with nausea, spasticity, movement disorders. We know that it helps with anxiety. CBD has no psychoactive component. It's a potent anti-inflammatory. It's an antioxidant. It's a pain reliever, and it reduces seizures. It reduces immune responses. The endocannabinoid system modulates a bunch of physiologic systems that we've already talked about. Everything from appetite to energy balance, everything from metabolism to muscle control, everything from stress responses to inflammation, memory to mood. It affects even intraocular pressure. So there's a huge area where endocannabinoids affect practically everything in the body. There's a lot of research going on right now with the use of marijuana and its oxidative stress and inflammatory actions on seizure disorders, on nerve pain, Alzheimer's, Parkinson's, brain tumors, multiple sclerosis, mood disorders, post-concussion stress disorder, or post-concussion syndrome, post-traumatic stress disorder. These are all being studied, even currently. The endocannabinoid system plays an overall role in maintaining homeostasis. So it basically affects just about every system in the entire human body. The endocannabinoid system is a group of cell receptors and activating modules or molecules. Anandamide is one of those molecules. The ECS is broken down into two main categories, CB1 and CB2. CB1 receptors are basically, CB1 receptors are affected predominantly by THC. CB2 receptors are predominantly affected by CBD. CBD activates CB2, and those are mostly immune cells in the peripheral nervous system. CB1 is THC, and it really is most of the things that we think about with marijuana. The pleasure, the memory, the thought, the concentration, time perception. Keep in mind that CB1 receptors, they don't really have much function in the cardiopulmonary center in the brain, but they do have some effect on pain. So CB1 receptors reduce pain without making somebody not breathe. Opiates affect the pain center, but they also affect the cardiopulmonary centers in the brain. So CB1 is a way to affect pain without affecting respiration, and that's why we think it's beneficial for patients. The concept of homeostasis is that your internal environment has to be stabilized even when you have external environmental changes. And the CB1 and CB2, part of the endocannabinoid system, are essentially things that maintain homeostasis. It's an active regulation of all the biological systems to keep them within a confined range. Your body doesn't want to be too hot, doesn't want to be too cold. It wants to be maintained just right. And that endocannabinoid system does that. It's not just CB1 and CB2. It's not just CBD, and it's not just THC. There's about 400 total compounds that live alongside these, and this is called an entourage effect. If you extracted just THC, you would be getting just THC, but usually when you get marijuana, you get all of these other compounds, and some of these can be volatile aromatics that are very, very delicate, like in the terpenes, and some of them could be like CBN1 and CBN2. There's a whole host of compounds, and so you can't look at this as it's only THC and it's only CBD. There's a whole host of other things, and the ratios between these have a huge impact on how they work for a particular patient, for a particular disease. And that's why patients seek medical guidance to help figure out what's best for their particular medical situation. The whole plant extract has over 400 trace compounds, and those trace compounds magnify the therapeutic benefits. So it's something that's a single molecule CBD is not equivalent to a CBD-rich whole plant cannabis extract. Totally different outcomes, totally different effects, and that's called the entourage effect. The plant as a whole has a totally different result than the plant single component. An example of this is Epidiolex. Epidiolex is used for seizure disorder, and it's a single molecule CBD with an extremely narrow therapeutic window, and you have to have extremely high dosages. These single molecules are less effective therapeutically than the whole plant CBD, and because of that, they have to use extremely high levels of CBD. And because it's extremely high levels of CBD, they can affect the liver in a way that we don't really expect. Terpenes are the volatile aromatic molecules. They evaporate easily. They're the thing that give the subtle flavor to marijuana. And different terpenes have completely different outcomes for particular patients. There's at least 200 different terpenes that we've identified in marijuana. The gross categories that we've got, there's about 7 of them: myrcene, pinene, linalool, nerol, geranol, limonene. There's a whole host of them. There's about 7. They each have different flavors, they have different smells, and they have different end results for the particular patient. The ones that we particularly focus in on, the most common ones, are the myrcene, limonene, carfilene, linalool, and apinene. Each of these have a different aromatic compound, and depending upon the aromatic compound, they have a different property, a different effect. For example, linalool is a potent anticonvulsant and anti-epileptic drug, and also is used in cancer, and it's also an antipsychotic, and it reduces anxiety. It smells like lavender or laurel or mints, which is different than apinene, which is actually an energy booster. It aids memory, and it's an antibacterial. Apinene doesn't have as much pain relief and doesn't reduce anxiety as much as linalool does. So depending upon the particular compound that we're dealing with, there's a completely different outcome and different treatment option. Cannabis therapeutics is really personalized medicine. What we do is we take conventional medical care and we add therapeutic cannabis usage, and we tailor that particular usage based upon THC concentrations, aromatic terpene concentrations, CBD concentrations, and we base it off of the patient's particular predisposing medications and how their metabolics are. There's not a single product or a single strain or a single ratio that works for everyone. So we have to figure out which works for this particular patient, because the receptor types are so diverse in the human body. If you do this wrong, THC can be extremely unpleasant. CBD neutralizes some of the intoxicating effects of THC, but makes it more pleasant. The cannabis oil concentrates have different concentrations of CBD to THC, different concentrations of terpenes, different concentrations of the other 400 compounds. So they can adjust or minimize psychoactive effects to suit the particular needs of a specific patient. The higher the CBD ratio, the more beneficial it is for anxiety and depression and spasm. The higher the THC ratio, the more psychoactive effect we seem to have. The time of day has a huge impact on CBD and THC ratios, and the terpenes add a significant additional layer of complexity. It can really confuse things, as in terms of different terpenes from different batches even of the same medication. Our recommendation is always less is more. Don't overdo it. Observe the effect, wait the adequate time, and never overdo. Start with very, very low dosages. Keep in mind that cannabis can have a biphasic property. A low and high dose of the same substance can produce the opposite effect. So we want patients to be extremely careful. Too much THC can amplify anxiety. In fact, there are some patients that have gotten something called cannabis hyperemesis syndrome, in which they got some cannabis oil that had concentrations or shatter that had greater than 70% THC, and they're stuck in the emergency room vomiting for the next 24 to 72 hours. And there's nothing we can do to stop that except wait the time. The problem is that more than half the United States takes prescription medication, and only 12.2% of the U.S. population is metabolically healthy. So that means about 87% of the population is unhealthy and has a chronic disease. These chronic diseases affect the liver and all the metabolics in the body. And if you add cannabis on top of this, it can have some significant side effects. The largest growing population of people using these medications is the elderly or seniors. And they're the ones most likely to take a bunch of other medications. So we have to be extremely careful with regards to appropriate treatment algorithms for this population. Cannabis is widely used in the U.S., and there's at least 3 different ways that the interaction between drugs and cannabis can have an effect. There can be a metabolic interaction where one drug affects the metabolism of another. It can make it longer, it can make it shorter, it can make it more intense, it can have some side effects. There's the drug distribution effect, as in terms of it can make the other drug absorb faster or slower, or it can change its distribution methods. Or the 2 drugs can work in the same way, or can they work in opposite ways? So it can have convergent or divergent pathways. So all of those things become relevant. One of the most common things that we worry about is effects on the cytochrome P450 system. Tetrahydrocannabinol, THC, enhances the pain-killing effect of opiates, and CBD can reduce withdrawal and dependence. But there's some issues. CBD is a really safe substance, but in high dosages, it can affect the P450 system. If you affect the P450 system and it affects blood thinners and opioids and statins, it can prevent some drugs from converting to their active form. For example, some of the narcotics have to be converted to active form to be useful. They're prodrugs. So there's a whole host of complications that can occur, and that's our job as physicians to help guide our patients in the best use and the safest use of these medications. Especially with prodrugs, that's a big factor. Prodrugs, if they're inhibited, they never become active. And if they don't become active, the patient actually has worse pain if they've received a prodrug after they've already taken THC or CBD. Then their prodrug doesn't get converted, and so they're basically not getting pain relief, even though they think they should, because they're using 2 compounds that they think both are going to provide pain relief, but one of them doesn't get metabolized right. Genetics has a huge component of this. Depending upon the genetics, some individuals may get relaxation and some people may get an unpleasant outcome. There's also a huge genetic variation in brain dopamine receptors, which may predispose some individuals, especially adolescents, especially males, to acute psychosis. THC typically has a safety net from overusage. THC has an intrinsic psychoactive property. If you take too much, you basically stop taking it because it makes you feel bad. CBD, there's no feedback loop. So people can sometimes overdose on extracted CBD and not even realize that they're overdosing. So there's a natural safety net with THC, but there's no natural safety net with CBD. And CBD actually affects the P450 system more than THC does. The route of use has a huge impact. Depending on whether you eat it, smoke it, transdermal, sublingual, all of these things have significant impacts on how fast the drug works, how long it works, if you're going to get a dysphoric reaction or not. And all of these things are things that we have to tailor for the patient when we make recommendations. If you take something orally and it gets into your gut, the liver gets a higher concentration of the drug versus if you inhale it. So the liver can have a significant effect on medication. And inhaling gets the medication to the brain faster, but it may have a totally different effect. What you want to do is make sure that you have clear labels on whatever you're getting. Everything that comes through a dispensary typically has a manufacture date, has a batch number, lab tested. You want to make sure that there's no mold, no bacteria, no pesticides, no solvent residues. You don't want to have products that have corn syrup, trans fats, GMOs, additional additives, thinning agents, or preservatives. You want to make sure that if they're extracted products, they're not extracted with toxins like BHO, propane, hexane. You want to make sure it's supercritical CO2 or ethanol that's used for the extraction. Vape products sometimes will contain a thinning agent, so you have to be very careful with that. You want to make sure that you understand what the oil is that it's included with. You want to make sure there's not propylene glycol in it. You want to make sure that there's no flavoring agents. You want to have cartridges that contain only natural cannabis derived from terpenes from the cannabis flower. You don't want to have other compounds in there that are going to be themselves carcinogens. At the end of the day, medical marijuana for chronic pain is probably a safe thing. You can expect some analgesia, pain relief. You can expect reduction of burning pain. You can expect muscle relaxation. You can expect a reduced stress response, improved disability scores. And we think that cannabinoid compounds are certainly safer than long-term opiate use. The key thing is that the patient has to be informed. They have to understand what this drug is and the potential discomfort and side effect. Although we think that it carries very low or negligible risk. We believe that for most patients, this is probably a decent approach. It's a probably decent method and idea to help reduce their symptoms.